hypothetical situation. The end of the day, you get home, yeah, it's like, come on in for coffee. Hypothetical situation. The end of the day, you get home, yeah, it's like, come on in for coffee. Yeah, things are going nicely. Yeah, it's like, you got all your safety equipment in the bedroom just in case. Uh-oh, gotta go brush my teeth. And you go back out and stuff happens. What's wrong with the picture?
Okay.
Today we're going to be talking about men, AIDS, and safer sex. This is my guest from the AIDS Center of Queens County, Pasquale. And you never told me your last name.
Well, I tend not to tell people my last name. It's Porco.
Okay, and what is wrong with that picture?
Okay, first of all, what's wrong with the picture is people do not tend to realize that brushing your teeth causes your gums, actually irritate your gums, which cause them to bleed. So right there is a port of entry for the HIV virus. So blood is present, and usually sometimes blood, you may not see the blood, but the blood is there. So brushing your teeth is not recommended before sex. If you'd like to brush your teeth, brush it 2 hours before. If you need that fresh breath, minty flavor in your mouth, I suggest mouthwash or chew gum.
Chew gum, Tic Tacs.
Tic Tacs, bread certs.
Okay, and basically, who needs to protect themselves from AIDS?
Well, I would say everybody needs to protect themselves from AIDS. Anybody involved in any risky sexual behaviors should protect themselves from AIDS.
Okay, can you define risky sexual behavior?
I would say any involvement with bodily fluids unprotected without a condom, any latex barrier would be unsafe.
Okay, so basically always wear one.
Always wear one, or two if you like, depending on how comfortable you are.
Okay, and any particular kind of condom that should be worn?
It is recommended to use latex condoms. Okay.
As opposed to the skins?
Lambskin have tiny little pores, which are not recommended. But if you are allergic to latex, what is suggested is that you use the lambskin and then double protect yourself with the latex over the lambskin.
Over it. Okay, so double up if you have to. Okay, and well, you brought a little something to show us.
I have my little toys here. Yes, I do.
Okay, so why don't we get this over with?
Demonstrate how to use one.
Because I'm probably going to turn bright red as you do it.
Okay. We have my little friends here. And right now what I'm using is a non-lubricated condom from Lifestyles, which is one of the best, I would have to say. Now, when you do take a condom out, remember, do not bite it with your teeth or fingernails, because what can happen is you can rip the condom. So carefully, gently squeeze the condom into the bottom and tear off the top and pull out the condom. And what you do is you grab the tip, which is called the reservoir, and that enables semen to flow into. And what you do is you grab the tip and you gently, firmly pull the condom over an erect penis. Make sure the penis is erect. And gently pull down the condom, making sure all air bubbles is out of the condom. But make sure that tip is there, because what happens, a lot of people tend to pull it actually all the way down, not leaving a tip. And what happens is when you're penetrating, what could happen is it could rip open.
From friction.
From friction, exactly. So you would have this reservoir tip over the penis. And also, you want to pull it off while the penis is erect also. So what you do is you gently pull back, holding the tip with the semen, pulling back, grab it off the penis and tie it up and throw it in the wastebasket.
Tie it up?
Tie it up and throw it into the wastebasket.
Okay, and then just wash yourself off?
And just wash yourself off. After every sexual act, you should wash yourself.
What about before?
Well, actually, you should wash yourself before if you'd like to, but I don't recommend brushing your teeth like I had mentioned before. Also, for women, douching. It's not recommended to douche before engaging in any sexual acts.
Okay, and should you not have the opportunity to wash or anything because you're in an unfamiliar place, should you carry condoms in your wallet?
I would recommend anybody to carry a condom who feels that they are going to engage in any sexual act.
I was told once that the wallet isn't a good place to carry them.
Well, actually not in the wallet because of the heat. Because what heat tends to do to the condom is disintegrate making it weak, losing the elasticity of the condom, so it can break in the middle of intercourse. So usually you store condoms in cool areas, cool temperature.
Okay, and what can be used with a condom?
Okay, you should always use a water-based lubricant, never oil-based. Oil-based meaning Vaseline, Crisco, baby oil, any hand lotion you shouldn't use. Those are all oil-based. Water-based is probably the most excellent one, KY jelly, and there are many others that you can ask your pharmacist for names and all.
Or in just an adult store.
Exactly, in an adult store. There's also a lot of condoms are lubricated already, and most of them have nonoxynol 9, which is a spermicide which kills HIV. And if you're allergic to that, then you should use something else, of course. But and never use the spermicide alone, because people tend to feel that since it kills HIV, they can use it alone. But you also have to remember, you're not only worried about HIV, you're also worried about STDs, sexually transmitted diseases.
Okay. And speaking of, I just want to touch on testing briefly.
Sure. Okay, well, they came up now with a new time frame. There's always something new in this field. With HIV and AIDS, you're always learning something new every day. Even educators are learning something every day. The time period, the incubation period, the window period for someone, for the antibodies to show up, to develop inside the body, usually is less than 1 month. So it's recommended for someone that has engaged in sexual behavior and come and show up negative results on the ELISA test or the Western blot, come out negative, and they feel they're concerned about their status, should be tested every 3 months.
Every 3 months?
Every 3 months.
I've heard
Before
6.
It was 6 months. Now it's every 3 months. You should be tested. Unless you're in a relationship, a monogamous relationship, and we always know that a monogamous relationship may not be that monogamous. So I would say, if you're with that one special person, I would say, and you've been tested, the both of you, every 3 months, up to about a year or so, and you feel that you want to start a family or anything else, or you feel you don't want to use the condom, then by all means.
Okay, and in a male-female relationship, is the condom you just showed us, is that the only option?
No, today there's many options, especially with AIDS around. We do have a female condom, which is called Reality, and you can purchase this in pharmacies or any novelty sex stores. The pricing, actually, I don't know the pricing on this, but today women have the option to protect themselves as well as men. So if your man doesn't want to use a condom, you have the opportunity to use a female condom, which is also a latex barrier that the female inserts inside the vagina. So, and you also have other little gadgets here. You have the finger cot that's helping you prevent if you have cuts on your fingers or anything such as that.
Yeah, because you can in the nail.
Right, you have bleeding hands, and you can do a lot of things with your fingers. So, and also a latex glove, which you can find in hospitals or in a pharmacy. And with safe sex, you could use anything, any of these.
Okay. What about for oral sex? Is it standard condom or?
Oral sex now. That's the thing now today. A lot of people still with AIDS around are not protecting themselves from oral sex. Oral sex, you have also the dental dam, which is a piece of latex. Okay. Now this is used for cunnilingus. Okay. Or if you want to go down on your partner, and this is a barrier between you and your partner. Okay, because you're worrying about bodily fluids that have high concentration of HIV, which is blood, semen, vaginal secretion.
Okay, and
it comes in many colors also and flavors, so it can be really fun.
Okay, flavor sounds interesting.
And if you feel this is uncomfortable, there's also saran wrap, which many people don't realize that you can use saran wrap.
Is there any particular kind of saran wrap?
They say you shouldn't use microwavable saran wrap because of the heat, but still there's low heat.
Okay, and condoms come off. Standard condoms come in flavors and colors.
You have many colors, many flavors, sizes, shapes, and forms, but as long as it's latex.
As long as it's latex. What about like flavored gels or?
Well, yeah, definitely. You can use flavored gels.
Just check the label, make sure there's no oil in them.
Right, exactly. As long as it's not oil-based. Okay, but flavored gels you can use for other than just intercourse or any oral sex. I mean, that's the term safer sex.
Right,
Other
safer
alternatives,
sex. Not safe
besides,
sex, safer sex.
Exactly, safer sex.
Okay.
Safe sex, we all know, is abstinence, and abstinence is no sex at all.
Okay, and that would be recommended for a young person, but this is, after all, the 90s, and it
Exactly,
doesn't always
this is
happen.
1996. Whether I'm out there handing out condoms or not, people are still doing what they want to do.
Right.
So I recommend latex condoms.
Okay, if you can't pull off the abstinence thing.
Exactly.
Yeah,
Abstinence is always number one.
Just give the magazine collection a workout.
Definitely, definitely.
Okay, as far as anal sex is concerned, is there any extra precautions that should be taken, or is just basically...
Well, it's also the same as anal, vaginal, oral, latex condom. I mean, it's totally unsafe not to use it in any sexual act.
Okay. Getting back to the female condom, say guy's dating a girl and she wants to use it and she's having a little bit, are there sometimes problems as far as attitudes?
Well, with the men, of course, there's that machismo, okay, where the man feels that there's no need for her to be using a condom because you're with me. But you have to be careful because you may not be as faithful as she thinks you are. Okay, so that's the purpose of her using the condom or wanting to use the condom. But the women, especially, I would have to say, I mean, I'm not, just targeting any specific race, but in the Latino generation, in the Latino race, the men sort of feel they're in control, they're the king. And if their women are recommending them using condoms, then they feel there's something going on, that she is sleeping around or something.
Okay, so it's more prevalent in that community, meaning, I guess it's cultural?
I mean, I'm sure it's definitely cultural. I mean, these are all barriers that prevent people from using condoms, actually. I mean, it could be anything from cultural to religion. The list can go on, educational, anything.
Okay, now, what if an individual is positive and their partner is positive? Do they need to use condoms as well, since they already have it?
Well, I would say definitely, because there's a factor of reinfection, and reinfection, which a lot of positive people don't realize, they feel that since they are positive, that's it, it's the end. I'm going to die anyway, but it's not true. Being HIV positive is just your body telling you to wake up and start taking care of yourself. It's not a death sentence. And a lot of people don't realize that when they are HIV positive, so they will go out and practice risky sexual behaviors and still abuse their bodies.
Right.
So there's that factor of reinfection, and reinfection is a lot stronger. The strains of the infection can be a lot stronger. There's different elements, different infections that come into play once you're HIV infected. So reinfection does occur, and it's double the dose and much stronger, I would say.
Okay, so it's like filling a glass, say a shot of whiskey, another shot, another shot.
Definitely. So reinfection does happen. So being HIV positive, like I had said, is not a death sentence. So you can conquer this, I believe, spiritually, mentally. It's all up to you how you take care of yourself.
Right, because as time goes on, you see people living with HIV for 10, 12, 15.
Right, and there are other people that do get sicker a lot faster. I mean, every individual has a different body.
Because it mutates so quickly.
Right, definitely.
Okay. And as far as safer sex is concerned, what can be done to spice it up and make it interesting?
Oh, there's so much. I mean, the whole thing about safer sex is so much more fun than unsafe sex. Safer sex, you can explore different lands, different worlds. There's role-playing, pornography, watching pornos together. The biggest thing that people don't realize, the best sex of all is talking, getting to know your partner, getting to know your feelings. Toys come into play. Okay. Mutual masturbation, massaging, oils, anything is possible with safer sex.
You said toys, so I'm gonna.
Well, there are many different toys that are in the market today. There are vaginas, there are vibrators, dildos, real life shape and form and feel. oils, handcuffs. I mean, there's whips, toys. Any toys can be safe. The thing about safer sex is, as long as you don't come into contact with any bodily fluids that contain high concentration of HIV, is safe. And that latex barrier.
Latex barrier is the saran wrap.
The saran wrap, the condoms, the dental dams, the female condom, the latex gloves.
Right.
Because remember, you can't catch HIV from shaking someone's hand or from kissing someone, but without coming into contact with that fluid, that bodily fluid.
And basically, if I sliced my hand open and you sliced your hand open and we shook hands, that would be the only way.
That would be it. And if one of us was HIV positive, certainly.
Okay, and okay, you mentioned oils also. The oils that you mentioned shouldn't come in contact with the latex. So what specifically are they used for? Massage?
Massage oils, definitely massage oils. They come in different flavors, different scents, and they can be fun. You pour them all over your body. I mean, you definitely don't want to have any open sores on your body when you come into contact with your partner. Definitely not. But a lot of oils, and the list goes on with toys. I mean, there's so many things out there today. Blow-up dolls. I could go on.
But as far as attitudes are concerned, there's as for men and women, does any particular gender have more of a problem?
Actually, there's a lot of people out there today that have a lot of problem with HIV or AIDS. A lot feel that they're not infected, or they're not infected or affected by it. And meaning affected, they don't know anyone that has AIDS or has come into contact with HIV.
That's probably not, I wouldn't think that would be true. Even if you don't know that you know someone, I think at this point everybody knows someone.
A lot of people do. They're aware of HIV,
Right,
and AIDS,
they just don't realize that they know someone.
They don't have to know any more than what they hear of it, because of the fact that they may feel they may not engage in sexual risky behaviors, or they don't use intravenous drugs, such as that. I mean, there are a lot of people out there that are not well informed, or they're not educated. And the reason being is not because there's not educators out there, it's because they refuse to listen. AIDS scares people away. So
I was talking with someone, just a friend of a friend had passed away from AIDS, and somebody had made a comment that she didn't know that there was AIDS in the neighborhood.
Oh, so a comment like that, what did I mean?
And I guess that would just basically be an uneducated person.
I would say, definitely. And I also have a little story that I tend to get upset about. I have friends that will tell me, oh, so-and-so is dying. Okay, dying how? Oh, they're HIV positive, which is bull. That really ticks me off, because being HIV positive, like I said before, it doesn't mean you're dying.
Right, people live with it for
exactly. There's
quite a while.
other diseases.
There is a life after.
Cancer, right? People just tend to feel that AIDS is just like this horrible thing. I mean, which it is a horrible thing, but it doesn't help the person infected anymore.
Right. Okay. Is there anyone who's particularly more knowledgeable about AIDS and safer sex?
Well, I wouldn't say more knowledgeable, because myself being in this field, I had mentioned this before, I am learning something new every day. And I think everybody in this field, medical, social workers, anybody in the health field, are learning something new and new every day with AIDS. But I would say a lot of gay men, and gay men mostly, because it was known when this disease first came out that it was a gay man's disease.
But it's not.
It's
It
everybody's
just happened
disease.
to hit that
Like
community
New York,
first.
like New York City, our beautiful city, it's a big melting pot. So is AIDS, because it doesn't discriminate against anyone. Anyone can get it if they're not safe. So gay men are more concerned about themselves today. So they're more careful.
Okay, and is there, I don't remember if I asked, is there anything particular in a same-sex relationship that should be addressed?
I think the sexual relationship, same sex, works the same as heterosexual, homosexual and heterosexual, and the same as women and adolescents.
Is it possible for a man to use a female condom?
I've heard of some men using a female condom.
Okay, I would think would that be more risky than the regular condom?
No, it works just the same. It depends on how comfortable you feel
Using
using
it.
it. I mean, as long as it's how you feel about yourself can really affect the way HIV and AIDS can come into play. Meaning, if you have so low self-esteem about yourself, or you just don't care, I mean, and drug use can also play a big.
Because I mean, you can't tell if your partner is a user.
Definitely not. It's just the same as you can't tell a person is HIV infected.
Right. So, I mean, if you're in a monogamous relationship and you don't know they're a user.
It can be a little difficult. I mean, but either way, you should take precautions. You should be safe always, no matter what. And then again, if there's no trust in this relationship, then I suggest that you be out of the relationship. You get out. And if you can't talk about it, I mean, there's that need to talk about it, to get to know each other.
So once again, we're back to communication. Communication's essential.
Communication's a big part of it.
Okay. And, okay, let's get into some of the services that ACQC provides.
Okay, I come from a great agency, the AIDS Center of Queens County. We're located in Rego Park. We also have 2 other offices in Far Rockaway in Jamaica. We offer a wide range of services for people affected and also infected. Like I said, meaning people that are surrounded by it, family members, friends, or anyone they know. We offer case management, counseling, support groups, peer education, which I work for the educational department, which is composed of 9 different components. We target different specific areas. People. I run the gay, lesbian, bisexual, adolescent peer education program. We also have the adolescent program, the women's program, the Latino program. We have the In Recovery program. We have ex-offender program, and we have lesbian and bisexual men program. And also the Asian Island Pacific program. And it's really a great program, and it really makes me happy to see people out there that are interested in this, in helping people, and in also educating themselves, not only educating others, but themselves.
Right, so people can call and get involved and become peer counselors, or...
Definitely. We also have volunteer opportunities, and the list goes on. If anyone's interested, we have a hotline, 718-896-2500. So please call, make a difference.
Okay, and we'll have that address again at the end of the show. What got you personally involved in...
Actually, many things. I'm a very, I guess you could call me a funny man. I love humor, and I see there's so many people out there, not just with AIDS or anything else, people that are unfortunate, that I feel that I feel like I like to help people. And I did come into, I was affected by it. I had a little friend, 5 years old, that had the AIDS virus, which passed away last December. And that hit me a lot. That hit me really, because here's a kid that doesn't know anything, doesn't even know what AIDS is, doesn't even know what HIV is not gay, is not a drug user, but a little kid. So that really hit me. It hit me hard. So I felt like I'd like to go out and help people and bring in a little humor and a little love into their lives. I mean, I go out there and people come up to me and yell at me saying that I'm promoting sex. I'm not promoting sex. I'm preventing diseases, HIV or something. Because whether I'm out there or not, people are going to do whatever they want, whether they use a condom or not. I can only do so much, and it's up to them to take the news, take the information, take responsibilities of themselves. So
basically, lost my train of thought for a second.
That's okay.
It just means I'm human. So basically, just do a quick review.
Sure.
Okay. Dental dams for oral sex performed on a female.
Also a male. It can be on the vagina or the anus. So your tongue doesn't come into contact with that person's body. But it doesn't keep your hands free. Is there anything that could be used where you would have your hands free? Definitely Saran wrap. Saran wrap. Because this is safe, but also it can be very scary. And yeah, very painful. It snaps. Very painful also, yes. That's a sensitive area of the body, I'm sure. But they also have a new thing, which is a mask, which is a I believe, cutout of a condom, which has a little piece which you stick your tongue in, but you pull it over your head like a mask. I don't have it with me right now.
Okay.
My colleague Lydia carries it with her.
It would be similar, but there would be
It's a mask,
an outlet.
right? An outlet for the tongue to slip through, and you're free
Right.
to use your hands.
And with anything, you'd have to be very careful of your nails,
Definitely,
because you could probably put some punctures that you can't see.
you can.
Okay, and the female condom,
The female condom.
just want to review.
Okay.
And
And then we have
what else we have?
different types of condoms, different
Okay.
name brands,
different
lubricated-
flavors,
different
different
flavors, sizes, shapes, and color. You have the finger cot, just in case you have cuts and you'd like to use your fingers for sexual pleasure. And then you have the latex glove, which you can find anywhere. So actually, I mean, safe sex is not giving up sex totally. It's just safer sex. I'm sorry, is not giving up sex totally. It's just knowing more about it. More, how do I explain? It's just taking control of yourself, I would say.
Okay. Well, I'd like to thank you very much for joining
Well,
me.
it was a pleasure being here.
Those phone numbers again at the end of the show. And, well, that's about all I have to say for right now, which is unusual. Thanks for joining us.
Thank you.
I completely lost my train of thought. Just stop for a second.